Hello, my name is Elizabeth Final, and I'm studying kinesiology as a prerequisite to becoming a physician assistant. A physician assistant is someone qualified to assist a physician and carry out routine clinical procedures under the supervision of a physician. My goal is to continue working as a physician assistant to start in family practice, because as I was advised that's the best place to start, so that way you kind of get an idea of how to treat the whole person instead of just the specialty that you want to enter into. So after family practice, I would like to either specialize in cardiology or orthopedics, and that's where the kinesiology degree comes in. I chose this field for a couple different reasons. One is because my first dream was to be a registered nurse for the longest time, and then I realized that I could push myself to do something more challenging than nursing, and I really wanted to set a higher bar for myself. It's been a struggle for me with school to continue, and I really wanted to make it worth it. In addition to that, I love patient care. I've had the great blessing to be able to have jobs where I could take care of patients and have hands-on experience, which I know is going to be a great asset for me with entering into any physician assistant program. And another reason is because I like puzzles. I like figuring out problems. I love diagnosing. So I know that with both those interests of loving to take care of people and figuring out what's wrong with them is what makes it feel like a good fit for me. In my presentation of what it is to be a physician assistant, I like to go over the 3 professional organizations and how they each apply to my area of interest and how they benefit me. So for the organizations that I chose, one is dedicated specifically to cardiovascular and thoracic education, which if I choose to do that specialty would really benefit me, because not only do they have hands-on skills courses, as it says, and the magazines, but you get to establish relationships with colleagues in that profession, which would really help if you're trying to get in to specialize in that area. Another one that I chose was FCPA, which is a Fellowship Christian network, and I think that would be great because not only do I get to do what I love, I get to integrate my faith into it too, and along with other fellow peers that are also with a Christian faith. And the other one is the PAOS, and that one, if I chose to follow the path of orthopedics, would be a great way to get my foot in the door with knowing people in that area, and then also all of the education that they offer through that organization. As I continue, I'd like to go over the current job trends. As you can see, the physician assistants are projected employment is up to 30% until 2024, which is a lot higher than most occupations. So the growth, the opportunities to be a physician assistant will be greater as the years go on. So I was surprised that the requirements for a physician assistant are not that in depth. If it's just really any health science degree, which is preferred, you could actually have a bachelor's degree in almost any area if you wanted to apply to a physician assistant program, but most prefer something in health sciences, and that's why kinesiology, a degree in kinesiology, works best for me. 2 grad programs that worked out the best for for the prerequisites that I would have for the physician assistant program was USC, the Keck School of Medicine, and that program for the clinical experience, hands-on patient care, accepts the type of job that I currently have as a prerequisite to enter into the program, which not all programs permit. Also, the shadowing experience is at least 1 to 2 experiences, so on average 20 hours. And a lot of the other programs, for example, at Western University of Health Sciences, requires, I think, over 1,000 hours of experience, shadow experience. And that's something that makes it really difficult, because when you're a full-time mom and a full-time student and you work part-time at 2 different jobs, then it makes it difficult to find that time to shadow that many hours before you can have a chance to enter into the program. And I'm sure it would delay me getting into the program if, God willing, I am accepted into it. My other choice was CBU, of course, and what's great about this program at CBU is that it's new and they're still forming it and making their changes, I'm sure, to adjust it for the students coming in and for what works for the university. So that would be exciting to get into CBU, especially since the CBU family has been great so far. So 4 upper division elective courses that I chose are, nutrition science, which I've already taken nutrition class twice, but a third time it would be great because maybe it'll get stuck in my head. Movement experiences for children. So especially with orthopedics, I know in LA County they have the Institute for Orthopedics for Children, the Children's Orthopedic Institute, and that would be a great place to work, and I would love to be able to work with children. I have 4 girls, so children for me is, it really hits home, and that would be a great field to work in, is definitely in orthopedics with children. Fitness assessment and exercise prescription. I know that with being a physician assistant, it's going to be necessary to know how to treat the person, not only their health conditions, but also physically, and I think that's where this would play. And then principles of conditioning athletes, and with all the injuries that athletes acquire in their sports, it'd be good to know that also, especially if I'm treating young adults or any kind of athlete. I'll need to know what kind of injuries that they're having and how to treat it best. So the greatest thing that I've learned about the scholarly study of kinesiology is just all the different avenues that you can take, that you don't have to be just a physical therapist. There's so many different other professions within kinesiology, and I didn't know that. So it was kind of cool learning all the different ways you can use the degree to be a professional. So lastly, I'm going to talk about the interview that I had with the physician assistant that I had the blessing to interview. She was actually retired, and with the permission of Professor O'Rourke, she allowed me to interview her last minute. And I learned a lot, and she asked me some very deep questions that I could tell came from someplace very personal, and it really got me thinking how dedicated you have to be to this profession. One good point that she made during her time interviewing me was that she told me that it would be great if first what I wanted to specialize in, because usually when you get out of PA school you want to specialize in something, and I told her I wanted to specialize in cardiology or orthopedics, and she suggested family practice first, so that way you learn to treat the whole person and not just the specialty area, and you can see the whole picture. And I thought that was a great suggestion, and if I'm allowed, that's what I really want to do, is focus first on family practice, so that way I can get the whole picture of the patient. In addition, she was able to share with me that that's what she did, is that she first worked in family practice, and then from there she specialized in OBGYN and worked with an OBGYN physician. Though I have a long road ahead of me before I become a physician assistant, I do have a few things that will help me along the way to getting there, and that's my fluence in Spanish. I'm fluent, not fluent, I'm fluent in Spanish and understanding. I would just need to do medical Spanish. I think that would really help me out. And then also all my hands-on experience with patients, working in a physical therapy clinic for 2 years, and then now I'm an infant hearing screener, which also counts as patient care, hands-on patient care, which would be great. And then all my volunteer time that I do with the ministry that I'm working in here at this church. Actually, if you can see behind me, I'm actually in the church right now recording myself. And so that really, I think, is going to be, has got me a leg up. So hopefully I won't have to do too much more. Some of the gaps I would need to fill is my shadowing hours, which I'm really looking forward to. And I'm working on getting into that right now, and I can't wait to start my shadowing hours, so that way I can see firsthand what I will be doing, and if I really think I can handle it, which would be interesting. I am grateful for this opportunity to learn more about my profession, things about it that I didn't know, and just learning. I think the interview was the greatest learning tool within the course, and so I'm very, very grateful that I had the opportunity to do that. In addition, the integrated faith was something that I really liked also, and week 4 talked about worship at work, and that's something that I learned in my Christian walk maybe a couple of years ago, is when you learn to do everything as if you're doing it for God. Everything, whether it's washing clothes or you're at work, you do it all like you're doing it for God. And just as the week 4 integration of faith talks about, it's another way to worship God. And I'm all about worship because that's what I love to do. I love to worship God. So if I can do it in anything, and especially when you're out in the world, I think that's very important, to not lose that focus, that no matter what you're doing, it should be God-centered and God-focused, and that's going to help you do the best that you can do, not for yourself and not for the people, but for God. It pushes you to a new level, and I think that's going to make you the best in whatever you do. Thank you so much for your time.